Good morning, guys. Tony Maritato here, licensed physical therapist. And in today's video, I want to share my top 5 mistakes that I see people make after a total knee replacement surgery. So the first one is, of course, not listening to the advice of your surgeon and your physical therapist. I'm like you. I almost always go in the opposite direction. If somebody tells me to go right, I want to go left. It is just in my personal nature because I believe generally that I know what's best for me and other people have no idea. But that being said, me being a physical therapist myself, having treated hundreds of people over the years, I can tell you that the advice I give someone, whether it's to do something or not to do something, it's based on practical experience and clinical knowledge. So if somebody gives you advice or makes a recommendation that just doesn't make sense to you, doesn't sit right with you, I would tell you to question it. I would tell you to talk to the therapist, the surgeon, ask them why they're telling you to do that. And they should be able to explain the rationale behind the decision. But too often I see patients that hear the advice, maybe don't process the advice or don't pay attention to the advice, and then weeks or months later, they wish they would have done it. So the second one is, of course, doing too much too quickly. There was a great post that came up in the Total Knee Replacement Support Group for Kind People on Facebook today, where an individual had been gaining range of motion, gaining knee flexion, and then suddenly stopped and started to decline. And I said, probably the number one reason I see something like that happen, assuming it's not an infection or a real problem, is because that individual is doing too much and not appropriately taking the rest breaks that they need. Our body responds to work and overload by getting better, getting stronger during the rest periods. So for some people, you could rest for 8 hours and be ready to go and exercise again. Other people might require 24 hours. Some people might require 72 hours. I don't know what the perfect rest to work ratio is for you, but I can tell you that if you're not making the gains that you expect and you know that you're pushing yourself, you're probably pushing yourself too hard. You're probably doing too much too soon. And you will find that by doing less, in many cases, you will get better results. The second one is not properly managing the pain. I've seen reports of people who have virtually no pain following surgery. I've seen reports of people who have excruciating pain following surgery. But I can tell you that at least in my clinic with patients that I'm working with, if they have poor pain control, we are really struggling to be able to do anything functional with the total knee replacement. Now, pain is not about tolerance. A lot of patients will say, well, I have a high pain tolerance or I have a low pain tolerance. Tolerance is not the issue when we're talking about pain. Pain is an experience. Pain is context related. If you're not sleeping well, which most of you are not, if you're anxious or nervous, if you're stressed out, if you're frustrated, all of those things are going to elevate the pain experience. They're going to make it worse. We need good pain control. Some of that will come through medication. Some of that will come through social support, family. There's lots of different ways to bring down the pain levels, but if we're not controlling the pain, while yes, this is a major surgical intervention, it does not have to involve massive pain and suffering. We have to be able to manage that. So too little pain control or poor pain control is a major mistake following total knee replacement surgery. The next one related to that is stress, poor stress management. Not appropriate planning for after surgery, not having things laid out. You know, I am a terrible planner. I never look ahead. I live in the moment. I take care of whatever I need to take care of right now and maybe for the next 5 minutes. Even recording this video, this is not a scripted video. I'm going by an article that I wrote that I posted recently, but basically I'm just telling you as these things come to me because I've experienced them in the clinic for over 20 years. But poor stress management will make everything more challenging. So if you're the kind of person that wants things to be in order, then go ahead and plan out your menus. Freeze the meals that you've created prior to surgery so that you can just warm them up after surgery. Know who's going to drive you to therapy. Know who your therapist is going to be. Like, do everything in your power to make the post-surgical time frame less stressful, you will have a better patient care experience and you will avoid a lot of the frustration that comes with the elevated stress levels. And then finally, not reporting symptoms that don't seem like they're normal. Not reporting them to your surgeon, not reporting them to your physical therapist. I know some patients feel like they're a burden. Some patients feel like they don't have the support of their therapist or their surgeon. The fact is, if something feels wrong to you, it probably is abnormal. There's probably something going on. And at least to have the peace of mind to say, hey, PT, this is what's going on. Is that normal? And the therapist can say yes or no. Most of the time, patients come to me and they say, is this normal? I'm happy to tell them, yes, this is totally normal. But there have been a few times where it's not normal. And I've sent patients to the emergency room because of fear of complications. And it's always been in the best interest of the patient when something like that has happened. So you need to have the people around you that you're comfortable with, that you're trusting in, that you can say, hey, I don't know if this is right. I don't know if this is normal. And you know that they're going to give you their honest opinion. So those are the 5 most common mistakes that I see, but I'm not the person who had the knee replacement. I would love to hear from you. What are mistakes that you wish you would have known about before you had the knee surgery? And what can you share with other people who are going to watch this video so that maybe they can avoid some of those mistakes? Go ahead and share them in the comments. If you haven't already subscribed to the channel, please do so. And I appreciate every ounce of support. You guys are an amazing community. Thank you so much for being here.